Hello, my name is Veronica Adams. I'm going to discuss the problem of premature birth in the United States. I am the mother of a premature infant, and I'm also a member of the Florida chapter of the March of Dimes. I'll be discussing statistics, some research, who's at risk, and what's available to prevent it. 1 in 8 babies are born prematurely. The rate of premature birth has risen over 36% in the past 25 years. With the introduction of the preemie bill in 2006, the rate has dropped from 12.7% to 12.2%. The preemie bill will help give researchers the tools and funds they need to continue to look for the causes of premature birth and how to prevent it. If you look at the PowerPoint presentation that I provided you with, on slides 4 and 5, there are some different research that's going on right now. Trying to find a better way to deliver nitric oxide to the lungs of premature infants with chronic lung disease is one of them. Another one, they're studying the role of omega-3 fatty acids in preventing abnormal growth of blood vessels in the eye that can lead to blindness in very premature infants. A new computerized family history tool that helps screen for preterm birth is one thing that they are testing out right now in a few of the larger hospitals around the country. The goal is to provide healthcare providers with this tool to help determine a woman's risk for problems during the pregnancy, so they can try to get her to full term and have a healthy baby. The March of Dimes described this as using state-of-the-art technology and building on the Hughes Risk App platform developed at Partners Healthcare for hereditary cancer risk. This new tool enables doctors to apply a sophisticated understanding of genomics and family history to give babies a healthier start in life. Patients will fill out a standardized family history questionnaire in their doctor's office using a computerized tablet rather than pen and paper. The information will then be analyzed electronically, and the tool will provide red flags and recommendations for healthcare providers based on the current professional guidelines. On the basis of this information, healthcare providers may be prompted to ask the patient more questions or even refer her to a genetic specialist. This is definitely something I wish was available to me with my previous pregnancies. In 40% of premature births, the cause is unknown. The 4 main causes are infections, maternal or fetal stress, bleeding, stretching. In about 25 of premature births, early inductions of labor or C-section due to pregnancy complications are the cause. But in these cases, early delivery is probably the safest approach for the mother and for the baby. 3 main groups of women are most at risk: women who've had a previous preterm birth, women that are pregnant with multiples, and women with uterine or cervical abnormalities. A few lifestyle factors that may put a woman at greater risk are late or no prenatal care, smoking, drinking, using illegal drugs, exposure to the medication DES, domestic violence, lack of social support, extremely high levels of stress, long working hours, and exposure to certain environmental pollutants. Medical conditions that increase the chances are infections, high blood pressure, diabetes, clotting disorders, being underweight before pregnancy, obesity, short time between pregnancies, being pregnant as a result of IVF, birth defects in the baby, and vaginal bleeding. It's difficult to figure out who will deliver early, but there are tools to help. Ultrasounds of the cervix to determine length is a great preventative measure. If the cervix gets too short, the woman's put on bed rest and considered for cerclage. The fetal fibronectin is a little Q-tip that they swab the cervix with, and If it comes back positive, the chances of the woman going into labor in the next 2 weeks is pretty high. If it's negative, they do it again in 2 more weeks. But it has a pretty high false positive rate, so that's why they're still researching a better test to use for that. The P17 or 17P is a progesterone supplement. It's either a small capsule or a weekly shot. It helps calm a contracting uterus and is shown to actually help lengthen the cervix. A cerclage is a stitch that they put in to help hold the cervix shut when it begins dilating too soon. If the woman is contracting a lot and is in premature labor, they can give her some tocolytics every few hours until that's stopped, to help stop her slow labor. If that doesn't work, they'll give her some corticosteroids to help mature the baby's lungs and other organs. Even though the rate of premature births has fallen since the preemie bill was passed, it's still the number one killer of babies born each year. It's costing us more than $26 billion each year. Babies born even just a few weeks early are at risk of severe health issues and lifelong disabilities. November is Prematurity Awareness Month. Each year on November 1st, the March of Dimes releases its report card for each state in the United States. In the past years, each state's grade was based off of the 12.2%. Not a single state earned an A. This year, things will be different. The March of Dimes has set a new goal. By 2020, they hope to get a new average of premature birth and get it down to 11.4%. The new baseline that they're going by will be 9.6 to determine grades. Take a look at where your state ranks. I bet it won't be as good as you think it is. And then take a look again when they put the new report card out this November 1st. Thank you for listening.